Hi everyone, thanks again for tuning in to the Seclair podcast video. My name is Caitlin Angeletti and I'm one of the physician assistants here at Seclair.
And I am Jim Ellermeyer. I'm a behavioral health therapist at Seclair.
We have a special guest today.
My name is Medea Ashraf. I'm a physician here and we'll be joining them today.
So today we're going to be talking about the difference between normal fears and phobias. And I actually think the way this whole kind of topic really can kind of work in a little bit to our podcast from last week. And last week we discussed a little bit about, the events that have happened recently in our community with Franklin Regional and how those events within the school district have kind of caused a lot of people to become fearful in public spaces or, just kind of question their safety in open areas and things like that. And we're going to go a little bit more into what an actual phobia is versus a normal fear and kind of, determining how we can live healthfully and happily without living in fear.
Yes, and all of us have phobias, every single one of us. And what they represent is the existence of fear and anxiety in the presence of a specific situation or object. And that would be called the phobic stimulus, which would be a snake or a rabbit, a butterfly, in an elevator. There's people that fear going through tunnels, which, as many of you, if everybody's going through the Squirrel Hill tunnels in Pittsburgh, you'll find out that everyone slows down because they're afraid. The main feature, it's an inappropriate fear response to a specific object or situation that's out of proportion to the danger that's posed. And actually, around 10 to 13% of the population in the United States can be diagnosed with a specific phobia. And Caitlin, you mentioned the Franklin Regional school incident, and specific phobias can develop after witnessing or being involved in a traumatic event.
Yeah, absolutely. I think a lot of times, these phobias tend to stem from somewhere, and determining that can be a really vital part of actually overcoming these phobias. When we know where the actual significant fear is stemming from, it's a lot easier to kind of focus your treatment and exposures to objects or situations regarding that initial stimulus that can kind of help you to handle significant phobias in the future.
Perhaps you could explain to our audience and to us what would be some of the physical signs and symptoms of phobias.
Absolutely. So phobias are just, as Jim mentioned, a very significant fear that's out of proportion to the actual danger that it presents. So, snakes, spiders, things like that. Certainly, we all have common knowledge that those things can be poisonous in certain areas of the world and things like that. And but a fear versus being startled or something versus a phobia really is significantly different, and our bodies actually show us the differences as well. So the physical signs of a phobia are pretty vast. We can experience difficulty breathing, having a racing or pounding heartbeat, chest pain or tightness, trembling or shaking, feeling dizzy or lightheaded, a churning stomach, hot or cold flashes or tingling sensations, and profuse sweating. And a lot of that has to do with the fight or flight response that our bodies go into when we first get exposed to our phobia. During that fight or flight response, we're in a very high state of stress oftentimes, and our bodies we talked about this multiple times, I think, on our little podcast about how stress can affect the body, and significant stress, especially in phobias. Different types of stress hormones get released throughout the body, cortisol being one of the main hormones that get released. And cortisol is pretty much, the cause of most of those symptoms that I had just mentioned. Having that body in that overactive state for an extended period of time during a phobic event can cause such symptoms as that. And the emotional signs are just as significant as well as the physical signs. Some of those which include the feeling of feeling overwhelmed, of anxiety or panic, feeling an intense need to escape from the situation that you're in, feeling unreal or having a kind of out-of-body experience with that phobia, fear of losing control or going crazy, feeling like you're going to die or pass out, and knowing that you're overreacting, but feeling powerless to control your fear. And I think that one's actually most important, because a lot of times we do recognize that our fears are unreasonable, but we just don't know how to control them. And a lot of treatments really involve just that, how can we manage these fears when we get exposed to them. And, being aware that you're overreacting is really the first step in overcoming them in the first place, because you're recognizing at that time that your fear is really out of control and probably not as realistic as it should be for the event that you're fearful of. You just don't know how to behave better in that situation, and that's really what therapy and counseling can do. But I think it's important to know the differences between what a normal fear is versus a phobia. If you want to maybe talk about that a little bit.
I'm going to be giving examples of a normal fear versus phobia. A normal fear would be a person that's just feeling anxious about flying through turbulence or taking off during a storm, which is a normal reaction. A phobia in that situation would be someone that totally avoids going on the airplane and needs to be at a certain situation and just totally avoids going on the plane. For example, missing his best friend's wedding because he's scared to fly. Another example would be, when you go through like a skyscraper or you go through climbing a tall ladder, you tend to get like butterflies in your stomach. A phobia would be turning down a great job because it's on the 10th floor of the office building. It's like, I can't take this job. It's fear of heights. Another example of normal fear would be getting really nervous when you see a big bad pit bull or Rottweiler, versus phobia would be totally avoiding the park because you might see dogs there. Another example that I want to give is feeling a little queasy when getting a shot or when your blood is being drawn, which is a normal fear, versus totally not going into the doctors while you're having a heart attack or something. So these are the differences between normal fear versus phobia, whereas phobia tends to be at an extreme level of fear versus normal fears, a normal reaction to a normal situation.
Yeah, exactly. And I think the kind of underlying point of those two differences is that the phobias really impact your life and your overall quality of life. You're missing out on, good job opportunities,
Right.
or not going on, paid vacations or things like that, that are actually inhibiting your quality of life solely because, you're having that fear.
Yeah.
And a lot of times, it is really scary to face our fears, but in phobic situations, that's really, the most effective way of overcoming them.
Sure, and there's three essentials to any disorder, and that's intensity, frequency, and duration. And here at Sinclair, we have a number of modalities we use, primarily dialectical behavioral therapy, and we do get a lot of adolescents here. We do get a lot of people who have younger children, and quite often they ask us, is their child, are they having significant issues with that? And perhaps, Medea, you could talk a little bit about what are normal things that children experience.
Normal things that children would experience would be, anxiety during common situations, such as loud noises in a young, like 0 to 2-year-old, would be loud noises, stranger anxiety, separation anxiety, being far away from, seeing new faces, basically. And from 3 to 6-year-old for a child would be imagining ghosts or watching, a movie with monsters in it, thinking there's a monster under their bed, which is pretty normal. Sleeping in the dark, sleeping alone, hearing strange noises. These would be considered normal fears for children. And obviously in the adolescent would be, more realistic fears such as injury, illness, and the example that she gave about the situation that happened at Franklin Regional. That would definitely cause a fear of going to school, which is a normal fear. Natural death, disasters, social performances. Those would be considered, normal fears and not phobias.
Definitely. And I think another thing to recognize too, sometimes phobias, sometimes are pretty black and white. We know exactly what we're fearful of and we know, maybe why. But a lot of times they might not be quite as clear cut. Oftentimes, you could potentially present with a type of generalized anxiety, you know, having anxiety about certain situations that are going on in your life. But, you know, when you actually go through the therapy and counseling and things like that, you get a little bit deeper into discovering maybe why you're having that anxiety. And a lot of people, you know, especially in later in life, you know, may have fears of being alone or fears of, you know, things going wrong in their life because of the way that their experiences have shaped them. And it's important to keep that in mind as well. You know, because not oftentimes does someone present, you know, to the clinic saying, I need treatment because I'm scared of this particular thing. And so that's just a good thing to keep in mind if you're having general anxiety symptoms, and then kind of considering really where all of that's stemming from.
Well, sure, and we always look at differential diagnoses. We don't just smack a label on someone. We look to see whether there's social anxiety disorder, separation disorder, panic disorder, OCD, post-traumatic stress disorder, an eating disorder, a substance-induced anxiety. And early intervention, particularly in children, is the key. And according to the DSM-5, an individual cannot be diagnosed with a specific phobia until the age of 13. And I'll have to ask you this, Caitlin. Are you afraid of the dark?
The dark? I don't know that I'm really afraid of the dark.
You were afraid of the dark when you were little?
Oh, when I was little, definitely. Definitely,
How
yeah.
about you, Medea?
No.
Good. You always carry a flashlight with you?
You know, it's a common thing, definitely, to have certain fears, and it's just a matter of how they really are affecting your life and what can you do about them. You know, if it gets to a space that you're really becoming depressed because you're maybe not leaving the house because you have agoraphobia, for instance. I think that's a pretty common example. You know, agoraphobia meaning that you're scared to go in public places, and more so that fear stems from a big public space that the exit isn't clear. Right. So it seems that, you know, people are more fearful that they don't have an easy way out of a situation like that. But you know, those type of things could really cause significant depression as well. You know, a lot of people won't go to the grocery store because they're fearful, or won't, you know, do kind of your normal daily activities because of those fears, and that can really lead to, you know, depressive type symptoms, you know, not wanting to get out of bed, staying in the house all the time, you know, not spending any time in the outdoors. And that's really important to kind of, I think, assess how it's affecting your life.
Well, sure, and people will say, well, what can I do about it? How can I do? Well, there's a number of techniques. There's a number of interventions. There's flooding, where you immerse a person in the situation, counter conditioning, where you substitute a relaxation response, systematic desensitization, biofeedback, modeling behavior, and others. And here at Sinclair, what we use is a mindfulness-based cognitive behavioral therapy, coinciding with DBT, the distress tolerance, the distraction, the self-soothing. And what the mindfulness-based cognitive behavioral therapy is we get people to be mindful and be the observer behind the thinker. We are not our thoughts. I could have a thought that I'm a flying pink chimpanzee, and maybe you thought that sometimes. However, and I don't like this word, but I'm going to use it, I know that thought's crazy. Yet, why can't we identify these other thoughts as just as incorrect? So that's the type of therapy that we use here. We get people to be an observer, to recognize, to identify and label overwhelming emotions and thoughts without responding to them. Learning how we take a wise mind approach. When in a specific phobia, we often operate out of an emotional mind. Sometimes it's as big as this room. So we look at that wise mind, and we learn how to respond rather than react to a situation.
Definitely. And once you've become aware of your phobia and kind of where it's coming from, it's a lot easier to work on being mindful about that situation. And the mindfulness part of the whole thing is really just to kind of think before you allow your body to overreact and get into that heightened sense of fear. You know, the world can be a scary place if we allow it to get to us, and I think it's just a matter of, you know, how can you live mindfully but, you know, without living in fears, because we know we can't predict things that are going to happen, you know, certain events and situations that we may or may not, you know, encounter in life. And, you know, how can we have reasonable fears that we are protecting ourselves, as well as not living in fear and not living our life to the fullest solely because of those fears. And I think mindfulness allows you to just at least sit back and think about the logistics behind your fear, and what you can do to deep breathing exercises and things like that to help reduce that high level of stress that your body's going through at that time.
And quite often people look to others to fix them. Kaylin, Medea, you see people every day that say, fix me.
Right.
And they want a pill or something that's going to the magic. We don't have any magic wands here. So tell me how you handle those situations, Kaylin.
And with phobias, there really is no pill that can resolve a phobia, and I don't know that there will ever be one, and I think that's really where the counseling and taking all of the mindfulness practices really into consideration. If it's something that you want to overcome, that's really the one way, most effective way of resolving that. Is taking it to seriously and trying to practice it and going even in a step-by-step fashion. Not all of the time do we have to be immersed in our fear entirely just to overcome that, but even just taking little steps, toward your goal, and just taking everything that your counselor has to say and really putting it into action.
As Dr. Chandray frequently says, we attempt to assist people in living in wisdom rather than in fear.
Definitely.
And as we end today, we hope everyone has enjoyed this podcast. Should you have any questions, please contact us at Seclair. There is a link to on this site where you can ask questions. We'll be glad to answer them. And as always, our hope is that you will follow Seclair on Google or Facebook and join us live Mondays around noon so you can ask your own questions for us to answer during our discussion. And stay tuned for these and other great articles. And please visit the videos in our website at www.seclair.com and on our YouTube page. And as always, be good to yourself. Be good to yourself, Kaylin. Medea.
Okay.